Okay, today we're gonna start another cyst which is very important cyst. It is the Dentigerous cyst. So let's start it. Bismillahirrahmanirrahim. Okay, so basically it is an odontogenic developmental cyst which is associated with the crown of the impacted and unerupted tooth, which develops later or almost or always to attach to cement to enamel junction. So always remember, okay, it is very important that you should learn it. It is with the unerupted or impacted tooth, unerupted or impacted tooth, and with the with the with that of crown. Okay, and it is always attached to the cemento enamel junction. So means the crown part of the tooth of the unerupted impact tooth, and it is always attached to cemento enamel junction. So how it will look, it will look somehow like when, so it will look like this, that the root will be covered by it will be covered by a follicle type. Okay, it is also due to which it is called follicular cyst. Important points, or you can say the most important, that accumulation of fluid is between the crown and follicle. So the fluid will accumulate here. Okay, then three important clinical features, you can say. It is more common in male, the young age 22 to 30 years, and impacted of third molar of mandibular. Then it is common in maxillary canine. So very important that you should remember, it is an odontogenic developmental cyst association with the crown of the unerupted or impacted tooth which develops later almost attached to cement to enamel junction. Important points: more common in male, young age, and impacted third molar. So basically, we have pathogenesis of two origins. Either it is extrafollicular or intrafollicular or extrafollicle. In intrafollicle, what happens that the fluid accumulates between the layers of the enamel organ, which is outer enamel epithelium and inner enamel epithelium. In extrafollicle, what happens that the fluid accumulates between the crown and enamel organ. Okay, so then in further we will discuss the expansion. It has how it expands basically. So now moving towards hypothesis, basically hypothesis about how it expands or how it basically spreads. So it is unknown first of all, but we have three hypotheses. One is eruption of tooth, the second is infection periapical region of the primary tooth, and the third is reduced enamel epithelium, proliferation and degeneration. Okay, so number one, we will talk about the eruption of the tooth. So what happens when the impacted tooth erupts? It puts pressure in the follicle. Within the follicle, there are veins. Those veins become compressed. So there is an increase in the intrafollicular pressure. Due to this pressure, it gives rise to the transudate formation. So transudate is formed and it starts accumulating in the follicle and crown. So the cyst formation occurs. The second, we have the infection in the periapical primary tooth, basically molars. When there is an infection in the periapical region of the primary tooth, especially molars, it spreads to the follicle of the secondary tooth, so that the tooth infected, it undergoes the inflammation, and due to this inflammation it develops the exudate, and that exudate will accumulate and develops the cyst. Now the third, we have reduced enamel epithelium, proliferation and degeneration. So normally what happens, that reduced enamel epithelium proliferate and it degenerates in the center area and give power for the eruption. But the superficial layer of reduced enamel epithelium proliferates, but it does not degenerate in certain area and give rise to the islands of epithelium. Within the islands of epithelium, it degenerates and fluid accumulates, and there's a formation of cyst occurs. Basically, we have. Okay, so we have three hypotheses. One is eruption of tooth, infection in periapical primary tooth, and reduced enamel epithelium proliferation and degenerates.